Good morning, one and all. It's a privilege to have you all today with us and discuss a very important topic that is useful for IBD patients as well as their caregivers. The world celebrated Mental Health Day on 10th October, and because of this, we realized that mental health is an issue that needs to be addressed to everybody in our group and in our forum. Today we have with us Dr. Rupa Banerjee, who is the Director of IBD Center at AIG Hospitals. And with us we also have Dr. Sabrina Kadri, who is the Consultant Psychiatrist to address issues on mental health. We all hope that you can enjoy the program and take advice and expert advice from these doctors. And we also will keep the forum open for questions that we will like to take and which we can address by these experts here. So over to you, Dr. Rupa Banerjee.
Good morning, everybody. Today is indeed a special day. And seeing so many of patients suffering from inflammatory bowel disease, I realize the disease is not the only problem. IBD is not the only problem. The struggles, the mental health issues are sometimes so overpowering, it changes the quality of your lives. And sometimes support, mental health support, will get you across all these difficulties. We actually conducted a survey of more than 8-9 countries across South Asia and Middle East. And what we found was surprising, that more than 75% of patients with IBD have some sort of depression, and at least 10 to 20% are suffering from severe depression. Similarly, there is a lot of anxiety. When we saw this, we realized that as doctors, sometimes we miss out on these important things. We ask you about how many motions you have had. We ask you if there is abdominal pain, but we forget to ask you, are you sleeping well? Do you really feel happy? Because I feel that also makes a significant impact. There is another area which we don't focus. That is the support structure for all of you who are patients. They're your primary caregivers, and I think we also surveyed the caregivers. They also suffer from a high caregiver burden, stress, anxiety, having to socially deal with a patient. And I think as a group of patients, caregivers, and doctors, this multi-faceted team can actually change your lives and overall improve outcomes. So today, in that way, is special. We chose to focus on something which might help you get out of the stress, the anxiety, and the worry of a disease which you have to struggle sometimes. And it's my pleasure actually to introduce to you our young, dynamic, beautiful psychiatrist, Dr. Sabrina Kadri. She's an asset. She helps many of our patients, and we will actually, I'll pass on the floor to her. We will be taking questions. For the last couple of weeks, we have put up this notice and we've asked for questions. So all the questions that have come from you, a select few we have picked up for discussion today. Over to you, Sabrina, before we take up the questions.
Thank you so much for a kind introduction, ma'am. It is an honor to share this space with you and talk about mental health. So I would like to start by saying that this gut-brain relationship is not something new that we are studying. It has been going on since 18th century. In fact, the words that we use the phrases that we use, like gut instincts, gut wrenching, butterflies in the stomach. That is how those things were started. So these kind of relationships have been studied in the past well, and it has been found that there is a direct relationship between mental health and the gastrointestinal system. So when patients are referred to us from the IBD clinic, most of them are like, why have we been referred? The problem is in the gut. So once the problem is in the gut is solved, the distress and the other things related to it will be automatically solved. But it is not that simple. So what I would like to explain here is that the symptoms are definitely in your gut, but that act as a trigger. So once there is a trigger, it actually creates a fear and anxiety in your brain, and that can in turn exacerbate or amplify the symptoms. So you might go to the doctor, and the doctor might do colonoscopy and other things, and you have pain, but then no cause is found, and then you are being referred to a psychiatrist. And the reason is stress, because the stress is exacerbated. It's causing what is called as visceral hypersensitivity. So there is pain, and that is what is causing your symptoms. So that is not the only thing how it is affected. So IBD, as you all are aware, is a relapsing remitting kind of an illness with no cure. So there is a lot of unpredictability that goes with it, and that creates anxiety. And there are a lot of issues that are created because of the illness, and the psychiatric issues that develop as a result of it are because of various, depends on the severity of the illness, the financial status, the social support that you are seeking, and also on how the disease is progressing and how the drugs are affecting your system. So depending on the onset, when the patient presents to us, that determines what psychiatric problems he might be predisposed to. For example, if the onset is in children or young adults, there might be body image issues, or there might be social isolation. So most of the patients who present to us, they say that they cannot go out, they cannot travel, because the first thing that comes to their mind is that they'll have to use washroom. Yes.
I think you're just telling this, which is very, very relevant.
Yes.
You know? We see so many patients who keep on telling us that it's been ages, wherever they travel, the first thing that they look for is where is the
Where is the washroom? Yes, that is a very
where
common
is the washroom? And such a simple thing, they go to their child's parent-teachers meeting, and what are they waiting for? Where is the washroom?
Yes.
So that itself is such a big stress. I think, Sabrina, you've highlighted a very important part over there.
So what happens because of that is that there is fear. So the person isolates himself or herself, and they do not go and meet anybody. So what that leads to is loneliness and social isolation, and that can in turn result in depressive and anxiety symptoms. So that is one important aspect of it. Another is how the disease progresses. For example, somebody has a stoma, so they have to, that also results in social anxiety and this body image issue. They cannot meet anybody, they have this sense of shame and fear, and they cannot do what they usually want to do or what their daily routine is. So they sort of shut themselves down in a place, and that can predispose them to depression and anxiety.
Sometimes also, you know, I think, and I want to tell all patients there, that there is an unknown fear. They don't know about their illness, so it's always that you think that maybe something bad will happen. There is something looming in the future. I think this is a forum, even as we just going to start taking your questions, to tell you, you are not suffering from an illness which is devastating. You have an illness, it is not a life-threatening in majority of cases. We have thousands of patients who are doing well, who are leading careers. We have so many warriors and champions within our support group itself who have excelled in whatever they have done. So know about your disease, know the facts, and that will solve this unknown fear. And I think we will take up your questions But here's to IBD patients. You can all do well, and we together will ensure that all of us and you are happy. Nalini, can we start with the questions? Because we should not be short of time.
Thank you, Dr. Sabrina, for the opening remarks. I'm sure we're going to have a very exciting session in the next 30 minutes. So we have collated a number of questions that we've received over the last 1 week from our patients. And we'll just run through each of these questions. So the first question is from a newly diagnosed patient who's been diagnosed with IBD. And he's extremely scared and anxious about the consequences. He's well read, so he's been reading a lot about the disease and is extremely scared about what his future holds. So he's asking whether he should seek support from mental health professional, and if so, what should be the predictors for him to go and seek professional help?
I think this is a very good question that you are asking. Remember, any disease diagnosis, initially there is an expected period of anxiety, and I think your gastroenterologist, or as we see you, we will try to allay your fears. But if something is beyond that and you feel that, you know, even if I understand, I'm unable to control the anxiety, always it is worthwhile taking help. And I think, Sabrina, you will be able to guide them as to what needs to be done. Because this is just the beginning of the illness. Do you think this needs psychiatric help immediately, or this should wait?
No, I absolutely agree with you when you said that there will be some period of anxiety while you are trying to, which is very natural and very normal. Anxiety has its own function. It prepares you to face the adversity, in this case your diagnosis. So it is difficult for a young person to deal with such a diagnosis. So anxiety is normal, but only up to the extent that it does not become incapacitating. That is, it does not affect your daily function. It does not affect your socio-occupational functioning. So if it starts becoming so overwhelming that you stop going to work and you are not able to do anything, and it is hampering you to seek help, in this case IBD, and you're not going to doctor to seek help, then you need a mental health professional support. Then you should go.
I think this is very, very clear. I think Sabrina has made it absolutely clear. If you feel that you are unable to control, it's impacting your social life, and you realize you don't want to go to school, or you don't feel you cannot concentrate, give it a little time. For body is the main adjuster. Your main psychiatrist is you yourself. You can understand, you can read, and you can explain to yourself. Beyond that, always take help. It is worthwhile to take help.
Thank you, Dr. Rupa and Dr. Sabrina. We'll move to the next question. This boy is an 18-year-old and been diagnosed with CD. And despite his age of 18-year-old, where he would want to look all macho and attractive, he is only 38 kgs and looks very lean. He feels he does not have any social life and he's worried about his body image. How should he deal with it?
Oh, I am completely with you. But don't worry, you're 18, and these thoughts, even if you were 48, you'd still feel, I need to look and I need to go to the gym. And once your illness is in control, you will definitely gain weight. Your target should be to ensure that you take the treatment as prescribed, adhere to the treatment, take nutritional support, and you will improve. Regarding your self-estimation, yes, right now you may feel that you are much lesser in weight. You might be concerned about your body image, and if it is bothering you too much, talk to us. And Sabrina, what would you say?
Yes, I would agree on that as well. So the body image issues, it's expected at this age, but then you should not let it affect your social life. It should not stop you from meeting your friends or going about your daily life or going to school or whatever you have been doing. So as long as that is not hampered, it's absolutely okay. So if you consciously go and meet people and meet your friends, hang out with them, I think you will feel much better by doing that only. And if it's bothering you, if you have socially isolated yourself, you should seek help.
But in general, don't worry. All youngsters of your age go through body image issues, is what I feel. Focus on your career, focus on your health. The rest part will improve on its own.
Thank you. In alignment with the previous question, we also have another young boy who's pursuing BTech, and he's a 21-year-old boy and diagnosed with UC. He's undergoing treatment and he feels he has understood his health condition. But now the counseling seems to be more for the parents because they are extremely worried and very paranoid, and they have imposed a lot of restrictions on him. So he wants guidance as to how can we educate the parents and help them out.
I think this is a very, very valid point, and I do empathize with the caregivers, and you must understand that your parents are so concerned about you. Sometimes all this stems from that. They really feel that, okay, I don't know why this disease happened, and I don't know how I can help to get it cured. So the only thing that they can do is take care of your diet and impose anything to ensure that you come out of it. So you need to understand your parents' side also. As primary caregivers, their intent is 300% to see that you are okay, you are happy, and you lead a normal life. Sometimes, yes, they may need help also. Caregivers may need counseling as well. And you may also ask your parents as to what can be done. And I think, Sabrina, what do you think that parents also, if they are worked out about it, I mean, we need to talk as physicians and explain that what level of restrictions are really needed for the disease. But the other part, you know, they see a young one, their only child or small child suffer, there's definitely a huge amount of anxiety. And I actually see, you know, so many parents, they're in tears.
Right.
When the child says pain, the child is unable to eat. So what kind of help do you think
So
is
one
needed?
thing that is important to understand is that this might actually adversely affect the health of the child if there is over concern, or there are such emotions that might interfere with the socio-occupational functioning of the child. So there are a lot of things that need to be addressed here. Fears of the parents. So we need to talk to the parents and educate them about the illness, about to what extent can they help and what they can actually be lenient about. Regarding the child, there is also that probably the child also does not understand. So there is one mechanism, psychological mechanism, that is called denial. So whenever we face an adversity, the first thing that happens is denial. Oh no, this is not happening. So the truth is so painful that psychologically we fail to accept it, and what happens is that we fail to do the measures that are important to come out of it. So it is very important that we address that. So whether the child is in denial, does he understand what is going to help his illness and what is not, and also the fears of the caregivers, that also needs to be addressed. So I think a communication with the counselor or a mental health professional or even the IBD specialist, I think that can help in this case.
I think you're right, Sabrina. I still remember, there was this young boy, and he said, this was just a 11-year-old, and he said, "Ma'am, I want to talk to you for 1 minute, and but not in front of my parents." And so the parents went out of the room. He comes to me, and all this long he was a smiling, bright boy. And then he comes to me and he asks me, "Madam, I'm worried. My parents are so worried. Do you think I am going to die?" I cannot ask them because they are always already so depressed. So I think we need to understand that even young children, 6-year-old, 8-year-old, they're intelligent. They are sensitive to the environment. So as caregivers, it is very important that you maintain an atmosphere, a comfortable atmosphere for your child if the child is suffering. And it's the same for even the adult. And I think, Sabrina, you've said the right thing. It's again, a multidisciplinary, everybody needs to work together to see.
And an open communication, they express their anxiety, they express their fears, however irrational they might seem, but they talk about it, and we understand, we validate the emotions, and then appropriately give the solution. So I think that is important in this case.
Yeah, I think, Sabrina, is all important for IBD patients as well. Nalini, any questions?
Yes, we've been getting a lot of live questions, and I'm taking up the question received from Hina, and she's asking them, the doctors, which is also, in fact, turns out to be our next question. As an IBD patient, she has asked that she has CD and can she conceive? So, how can she plan a pregnancy and can they have a baby?
I think you definitely can have a baby. IBD does not mean that you cannot have a baby. There have been n number of studies which have shown that on treatment, when the disease is quiet, you need to understand when to plan the baby. The best time to plan the baby is when the disease is quiet. So a quiet disease, best time to plan. Pregnancy outcomes are generally not altered. Even if there is a flare-up during a pregnancy, we are competent enough, we have the necessary equipment, the necessary medical treatment options available to get your disease in control. So yes, you can plan. Your IBD specialist is going to discuss with the gynecologist or obstetrician that you are meeting for, again, there should not be any communication gap there. Medications, most medications can be continued. So if you stop all your medication, risk of relapse is higher. The other question that often parents ask, and would-be mothers ask, is that will the child also have the disease? Let me reassure you, there is a small percentage of familial IBD. In India, we've just published this. It is as low as 2 to 4%, of which direct from parent to child is less than 2%. So in the family, there might be some IBD, there may be a little bit of genetic factors, but it is not enough for us to say, do not plan a baby. You can plan a baby with the modern therapy options that are available. You should have a normal pregnancy and a good outcome. Whether cesarean or vaginal, that is on a case-to-case basis, and we can take a call on that. So, any other questions?
Our next question is from a software engineer who's been diagnosed with IBD 3 years ago. He has been hospitalized several times due to his health condition and has had frequent relapse. So he actually wants to ask, which is also one of our other live questions, who's also a patient who's from a UC patient, and he asks whether he can ever expect a normal lifestyle and should he be worried about the next flare-up. So in continuation, people of a marriageable age also have this constant worry because of so much of uncertainty in their life. Can anyone actually get married to them?
So before I ask Sabrina to answer that, you should come and see us at AIG. We have so many married patients. So yes, you can get married. There are many who will marry you. But regarding the worry, Sabrina, what do you think?
So I think it's very important for a person to understand the illness. So once you understand that there will be relapses, okay, nobody is going to tell you that no, there will be no relapses. But then what is important for you to understand is that the only thing that will make it easy is acceptance of the illness. So you have to accept it and make sure that you are always in control, that you seek help, that you adhere to what the doctor has suggested you to do. If you do all those things and take care of all the aspects of it, I don't think there will be, you will be able to handle it. I cannot say that there will be no worry or you will not face anything, but then it will be easy for you to handle it, definitely.
And I think another important aspect over there is, your partner should be aware. And if you both handle the situation together, it's usually the best, most comfortable for both of you. So yes, you can get married because you don't have an illness which is, life threatening. It can be troublesome at times, but if you see statistics across the globe, majority of patients can lead a normal life. It can have a few relapses. We cannot really predict who will have how many. We have had patients who have relapsed once in 10 years or few attacks and then no attacks altogether. We have some who have multiple relapses in a year. So we have to understand your disease, treat you accordingly. Newer and newer drugs are arriving. We are having new drugs for India also by the next few months. So options are increasing, and I think there's no reason for you to worry.
We'll move to a patient story, which is actually a case probably witnessed by many other patients also, and it's something very similar to a live question that we have also received just now. So this is a story of a civil engineer by profession and who had a lot of travel as a part of his job profile. He was diagnosed with CD in 2017, and because of the frequent relapse and the other patient who's joined our group and is also asking it as a live question, he says he can't join duty due to fatigue, pain and extreme anxiety. And he's the only breadwinner, and because of his deteriorated health condition, he's worried how can he run the house and how can he take care of his family, as IBD has definitely made his life miserable.
It is definitely difficult, but difficulties are not only for IBD patients. During the pandemic, there were so many who lost their lives. There were so many families who lost their only breadwinner. A sudden recession, so many people lose their jobs as it is. So as a patient, you must think that this is all a part of your life, sometimes unfortunate, but I think you need to think and remember these are all transient things and you will get over it. That faith you should have. But I think Sabrina will guide you as to how you should deal with it if you are really impacted. Sabrina, I think this is one, you lose your job, and I think it's not only for patients, even for the caregivers,
right,
that affording the treatment, the costs keep on piling up, investigations. IBD sometimes is a costly disease. What would you say, how to cope?
So yes, one thing that is important here is that you talked about that there is a lot of anxiety and it has made life miserable. So that is one aspect of it that is completely treatable. So that is, you have to understand. So if you go to a professional and probably a psychotherapeutic approach may be taken, or a pharmacological approach, whatever it is, but it is completely treatable. So one aspect of it is completely under your control. So other aspects like the loss of job and problems at financial issues, those have to be taken up separately. So everything has to be taken separately, and there has to be problem solving related to it. So in any case, whether whatever the issues are you are having, there has to be, as ma'am said, a multidisciplinary approach where you can talk to a psychologist, a social worker, and who can help you to deal with all these things. So help is available. That is important for you to understand here.
And do you prescribe antidepressants to them, Sabrina, when there is really a problem? And do you think that antidepressants, anti-anxiety drugs are useful?
Yes, and it has been actually seen in multiple studies that these lead to a favorable outcome of the illness. These really help, and it's not that it's not necessary that always you will be prescribed a medicine or so. Sometimes if the illness is mild, if the anxiety is mild, psychotherapeutic approach, cognitive behavioral therapies we can do. But then if the disease is to that extent that the mild to moderate depression, or we feel that it's going to help you, then you should take medicine. Definitely take medicine. It will help. Not just in relieving anxiety, in controlling the IBD symptoms as well.
We have a lot of live questions coming up, and I'm combining two questions. And here we have one patient who's asked, when I'm in diarrhea, I feel very angry. Is it normal? And similar to that, he says that he's a UC patient and doing much better. But however, he still has anxiety, panic attack, and he loses his temper very easily. So how can he control the above symptoms?
This is a very good question. Yes, I think frustration on the illness can often cause it. But Sabrina, how do you think we should deal with it? Do you think that for such tempers it needs treatment, or just counseling itself?
I think counseling should be definitely the first method that we should use. But then also I would like to say here that preparedness is very important. So if you understand your illness, you understand there are going to be relapses, and if you are prepared for that, it will be much easier for you to deal with it. So once you're anticipating it, you know that it is going to, and what I have to do when such thing happens, it will help you to deal when the relapse occurs, and I think that should work.
I think another small thing I'd like to say, it's always better to vent out or talk to someone.
Yes.
And I recently heard a famous film star saying this on TV, and I thought it was quite relevant. He says that if you're really feeling lonely, and you really don't have someone with whom you can share, just stand in front of a mirror and talk and tell your problem. You'll suddenly realize that the problem is not as much as you were thinking about it internally. And this, I think, I heard it on TV recently in one of the shows. Mr. Amitabh Bachchan was talking about it. So I think hearing that, I felt that yes, mental health can affect anyone, and you need to talk about it. You can talk to your doctor, you can talk to your family, your friend. If not anybody, talk to yourself and find out what is impacting you.
We'll probably take up only another 3 more questions, and because though we have a lot of questions coming up in live, I think we'll definitely promise the patients that we'll answer them on the support forum. So going back to another interesting story that we had dealt with in our hospital. She was diagnosed with IBD when she was only 16 years, and she got married at the age of 22. And because of any support that she received from her husband as well as her family, so during hard times she was all by herself, and that unfortunately landed up in a divorce after 5 years of marriage. So I would like to hear the comments from both Dr. Rupa and Dr. Sabrina on how would you handle such a case.
I think, Sabrina, let me hear from you how to handle a divorce. You must be seeing a lot of cases.
Yes, definitely. The illness is of such a nature that it affects every aspect of the life. And as physicians, we can be sensitive about it, empathetic about it. And yes, given that it has affected so much in your life, what you need is to seek social support, financial support. I hope you are having support with your family that you are living with. And also the financial support. In case you are having issues with that, you can always come and talk, and we can figure it out. So these are real life problems that need real life solutions rather than just.
I think a real life answer would be that every aspect of difficulty that you face is always transient. It's always transient, and if you think of it, of the same problem on a next fresh morning, you might just feel that it is not worth it. So nothing is more important than you, how you feel, and nothing and no one is indispensable. So I think you have to charter your own territory, take help on the way. We are always there as physicians. We intend to support you, whether you have IBD or not have IBD, but reach out for support. It is all there. It is all, we are there to help you, but you must help yourself as well.
This is again another live question. Is CD life-threatening? I always live in fear that it may land up in cancer. I'm constantly worried.
I think all the questions are going down to the same question of anxiety and depression. I must reassure you that cancer is known to be higher in IBD, but let me give you the statistics. For the first 10 years of illness, cancer is rare. After that, the incidence is higher. But when it is higher means out of 1,000 or even more, even after of 10,000 patients, 2 may develop a malignancy. So out of 10,000 patients, 2 developing a malignancy is not a major thing. At max, even with the treatments, it is around 4. So your risk of, you should cross the road carefully, because your risk of having a sudden, traffic accident appears to be higher than your risk of having cancer when you have inflammatory bowel disease. So do not worry about cancer. The second reason why you should not worry is, nowadays after 10 years of illness or after 8 years of illness, we can screen, do surveillance colonoscopy procedures, and during the colonoscopy, if we identify anything which is early malignancy or suspicious, we don't need a surgery, we don't need anything. We can do simple procedures which are being done at our hospital all the time and remove it then and there with no consequences. For you, it will be just like a normal biopsy. For us, it will mean we will remove the entire suspicious area during a colonoscopy. So there are options available, but it's not like I have IBD, so there is a 50% risk that I will have cancer. First 10 years, nothing. After that, follow the surveillance procedures. Your risk of malignancy is not going to be very high.
So I would like to add here that there are things that you can control and there are things that you cannot control. Things you cannot control, there is no point worrying about it. Yes. So there has to be a positive reframing of your thoughts, a positive mindset. So things you can control, you should write it down and find appropriate solutions from them. Things you cannot control, you should just leave them. I think that will help.
So we'll take up the last question now, and this is, I think, again, though it's been a part of your discussion earlier, but we have got repeated people who are answering this question, whether they should take antidepressants for the rest of their life, and can they ever come out of this kind of medication?
When you are prescribed an antidepressant, so first the straightforward answer would be no, but there are a lot of factors. Okay, so when you are prescribed an antidepressant, so obviously the doctor feels that the benefits for you are much higher than the risks associated with it. Okay, so when you are prescribed antidepressant, it depends on a lot of factors for how much duration you are prescribed. So if there is a family history or if you have had any previous recurrences, the duration will be probably 1 year, 2 years. But then if it is a single episode, the medication will be tapered off in probably 6 months. So what you have to remember is that you have to follow your psychiatrist, whoever has prescribed you antidepressants, and then you do not have to stop it on your own. And then whenever it is stopped, it is by gradual tapering of the medicine and not all of a sudden. So these are the things that you have to keep in mind when you are taking antidepressants. So no, not lifelong.
Thank you so much, Dr. Sabrina, for your valuable time, and thank you, Dr. Rupa, for your words. We still have a lot of other questions that are coming up, and some of them are disease related, so I think we'll answer them specifically. And we also have questions asking them whether when they are in an emergency in CD and how should they deal with it, so we can probably quickly take that up. And they are extremely worried about how can they actually reach out to a nearby hospital because they're far from AIG. So
I think a doctor anywhere is a friend. So wherever you are, if there is any issue, reach the nearest available doctor. We are available after that to even talk to your local physician and help with the treatment. And of course, if there are anything specialized that needs to be done, we will call you here. We can often guide the local physician as to what the immediate treatment should be. Mostly with inflammatory bowel disease, other than relapses, major emergencies like perforation are not very common. If it does happen, do not worry, it is treatable, and then you should be in touch with the local physician. So for every one of you patients who come to AIG, I would suggest that you should have a local contact. However, you can mail us, call us, and we will be available for any kind of advice. If possible, drop by. It may be worthwhile to visit us for any advanced form of treatment.
So with that, I think we can end our session today, and extremely happy and delighted to have Dr. Rupa and Dr. Sabrina for addressing a very critical issue in IBD. And we will definitely answer all the questions that have been coming up live, individually or else on the forum directly. So I would like to hear concluding remarks from Dr. Sabrina and Dr. Rupa on what is their mantra and how should they actually advise and guide both patients and caregivers.
Maybe you can take.
Okay. So for patients, it's very important to follow certain steps. So first of all, healthy lifestyle, physical activity, no matter how bad the illness is, make sure that there is some sort of physical activity. We actually say that 30 minutes per day or something, but then if you are having a relapse and you're not able to do, just moving around the room will be enough, but do it. It's very important to follow a routine. Okay, so activity scheduling is very important. Then obviously diet, Dr. Rupa might tell you more about that. Diet is very important. So what we can basically manage is that the relapses, that we can prevent the relapses. So for that also I would suggest that meditation, yoga is very important, and to be in touch with the religious and spiritual aspects of your life, that would be very important. And whenever you feel that things are getting overwhelming, talk to somebody. Don't isolate yourself, seek support, talk to your family members, talk to your friends. If you're not able to, it's advisable that a face-to-face communication is done, but then if you are not able to do that, make sure that you are in touch with your friends on phone or whatsoever. And learn when the symptoms become overwhelming and incapacitating, and then seek help accordingly. And what else? Just a healthy mind, healthy body, remember that. So both are important. Thank you.
I think, Sabrina, you have summed it up very well. I would only like to really thank all of you at the India IBD Support Forum. All of you are there for each one of you. So I think the support forum is a very important platform. I'll encourage all who are feeling better, share their experiences. All who are feeling low, share their experiences. There are many who don't come out, but when they hear about another, they feel that yes, they can also deal with it. I take this opportunity to thank the primary caregivers. We found that you suffer a lot too, but you are always there as the primary support for our patients. And I think I take this opportunity to thank you. At the same time, I think this podcast could not have happened because of, without the support of our back-end team here at India IBD Support Forum, for taking up your questions, preparing slides, designing the slides. It has been Dr. Nalini Raghunathan, Dr. Yamuna, and Mr. Vishwesh, who have relentlessly worked and are the pillars for the India IBD Support Forum. We have an excellent audio tech team, and director would be, I think, Mr. Robin Chatterjee, Mr. Mohan, and without all of their support, we would not have been able to join here together. So thank you for all your support. Do visit us at AIG anytime you are in need, and be a partner at the India IBD Support Forum. Thank you.